I was originally on a nursing path, and I was feeling a little lost. I went home over fall break, and I was talking to my mom about it, and she was like, your sister's in PT. You should go with her to PT and just see what you think about it. Like, I could see you being a physical therapist. So I went to PT, and I became a PT.
Did you have any aha moments during your time at CUDPT that kind of shaped the career path you're on now?
Yes. So Dr. Michelle Green and I were talking my third year, and she's this amazing neuro PT, right? So brilliant. And I was like, I want to be like her. And I was like, what could you see me doing? And she was like, pelvic health. And I was kind of bummed. I was like, that's not what I want to do. I didn't really know enough about it. And I was about a year out of school, and I was not really happy. I was treating just in a primarily orthopedic setting. And so I started scrolling through our free CEU classes, and I saw pelvic health and her little voice in the back of my head. I was like, okay, maybe I'll just watch this. And I did, and I became obsessed. I started reading everything, and there we go.
And a lot of folks aren't familiar with how pelvic health and physical therapy walk hand in hand. Can you tell us a little bit about that?
Yeah, so with pelvic health PT, I think it fits into every single setting. We're going to get our athletes, we're going to get our geriatric population, we are going to get our pediatric population. Everybody has a pelvic floor, everyone pees and poops, and so the pelvic floor affects everyone.
Okay, and so tell us a little bit about the how, what, and where you practice.
So I work in an outpatient hospital setting in Cary, North Carolina, and there's 12 of us PTs who do pelvic health PT. So there is a huge system and support system here. So the last clinic I was at, I was the only one, and so it was a little hard. I had to kind of figure it out on my own. And here, we just ask each other questions. We have monthly meetings, and so it's so nice because we truly work in solitude usually, like in a room with a door, and so being able to have people who communicate with one another is really nice. I wish everyone knew that there is help if you're not moving at your best or functioning at your best or able to do something that you used to be able to do and can't do now. Pelvic health, I wish everyone knew how common the symptoms are, even though they can feel shameful to talk about and feel a little uncomfortable. But I always tell my patients, there's nothing you can say that's going to surprise me, even though it feels like. I'm really excited about all the pelvic health PT talk. I think that so many people are talking about it, whether it's social media or just so many more options for continuing education, which is really nice. And so the more we talk about it, the less stigmatized or maybe off-putting it can be for people to talk about. I hope that everyone knows just a little bit so that way we can get people to where they need to be versus suffering for years and years without any direction or guidance. I think the more that every PT knows, the more benefit it's going to have to the patient.
Now, if you could go back and give your student self any kind of advice, what would you go back and tell yourself?
You don't have to be perfect. You just have to be better than you were the day before. And you don't have to know everything right now. Getting repetitions in and seeing people, you're going to get that skill set. Just trying your best to help people is just what they want. They just want you to listen and they want you to try. And also maybe a little more confidence. I think that would have been helpful for me as a student. For pelvic health specifically, if anyone is having problems below the belt is what I always say. So having any dysfunction with peeing or pooping or sexual dysfunction or something down there just isn't feeling right, and you check out with your PCP or your gynecologist or your urologist and they're like, yeah, I'm not really sure, that would be a great time to go see PT. I think that what you do matters, and keep learning and keep growing for our patients and pushing forward and pushing our profession forward.